with comments from Health Commissioner Jan Malcolm, Minute Commissioner Tarek Tomes, and MDH Infectious Disease Director Kris Ehresmann. We'll then open it up for questions from reporters on the line. With that, I'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. Minnesota is reporting 1,335 additional positive cases today out of just over 30,000 test results received yesterday. This brings us to a new total of 438,867 positive cases of COVID in Minnesota since the start of the pandemic. Sadly, we had another 13 COVID-19 deaths reported yesterday, for a new total of 5,724 deaths since the start of the pandemic. The deaths we are reporting today include age ranges from the 50s up to the 100s. Hospital beds in use due to COVID-19 increased just a bit yesterday, but generally have remained stable. We're going to talk some about vaccine administration again today and roll out a new dashboard for keeping track of our state's progress. 152,849 total doses of vaccine have now been administered to Minnesotans. This is actually as of last Saturday. The number of actual people who have received one or more doses of vaccine is 144,503, meaning that some people have received more than one dose. There have been 329,450 doses shipped out to Minnesota providers so far. That doesn't mean they've actually arrived at the provider sites necessarily, but that they've been released by CDC for shipping. The weekly change in our case growth rate does continue to decline. Week over week, we're now at 3.2% increase in cases. This is down from a 3.5% weekly increase the prior week. Weekly change in testing continues to fluctuate, but is basically stable at about a growth rate of 4.3% a week. The 7-day average testing positivity rate that we talk about so often has been inching upwards each day and is now at 7.5%. With that brief situation update, I'd like to now introduce my colleague, Commissioner Tarek Tomes from the Minnesota IT Agency. Commissioner Tomes.
Thank you, Commissioner Malcolm, and good afternoon, everyone. Today, Minnesota launched its new COVID-19 vaccine dashboard on the state's COVID-19 response website. You can find the dashboard along with other important vaccine-related information at mn.gov/vaccine. So many of our hopes are connected to Minnesota's ability to provide COVID-19 vaccines. We wanted to share this information in a meaningful way, a way that helps shape opportunities for improved vaccine delivery and provides clear insight into the decision-making process. Minnesota's vaccine dashboard shines a light on important data and information in order to shape and promote the best possible outcomes. It highlights opportunities for critical voices to be uplifted, democratizing data, and create space for the people we serve to raise important questions. The vaccine dashboard supports a covenant of accountability and gives each of us individual insight into our state's collective progress. This information is presented in a user-friendly visual format with the dashboard on our website, but we will also make data available for download. Minnesota's vaccine dashboard helps people to see in one place information about the type of vaccine doses that have already been administered, progress in our statewide vaccine distribution efforts, the amount of vaccine promised to Minnesota by the CDC, and so much more. Vaccine distribution is dependent on coordination between state, local, federal government, and hundreds, if not thousands, of providers across the state. Bringing this data together has been an incredible effort to ensure smooth collaboration and data sharing. This at-a-glance dashboard will be updated each day at 11 a.m., and it provides Minnesotans with confidence that COVID-19 vaccine doses are consistently arriving in Minnesota, that shots are going in the arms of our frontline workers and most vulnerable family and friends. Making this data available and consumable will help Minnesotans visualize our progress towards ending this pandemic for good. For more information about the data that Minnesota is sharing in this dashboard, I'll turn it over to Kris Ehresmann.
Thank you, Commissioner Tomes. We know that data is of great interest to people, and it has been throughout this pandemic, and we know that vaccine data is no different. The goal of this new dashboard is to provide a more visual and user-friendly way to view key vaccination data for our state. While we're trying to make the data as easy to understand as possible, it is still complicated with the different types of vaccine allocations there are and what we're able to track. For example, as we've said before, there are some entities in the state getting vaccine directly from the federal government, such as Veterans Affairs and Indian Health Service. We don't necessarily have insight into how many doses they're receiving, and we may get some data reported to us on doses administered from those allocations, but not all. So we want to acknowledge that limitation. A few data elements that are new on the dashboard include doses shipped to Minnesota providers. This doesn't mean that they have all officially arrived, but it reflects how many doses have been marked as shipped in CDC's vaccine tracking system. Showing people who have received one or more doses and people who have completed the vaccine series. So one or more doses will essentially be a total of all the doses administered. The people who have completed the series is a subset of that number. For currently available vaccines, a complete series is 2 doses of the same vaccine product appropriately spaced out. The dashboard shows doses that are being directed to CDC's Pharmacy Partnership Program for vaccination in long-term care settings. Those doses technically come from our state allocation, but we don't have a role in distributing or administering them. The percentage of doses is a way to get a snapshot of what proportion of doses have been administered from what's been sent to us. This percent is calculated by taking the number of doses administered divided by the number of doses that have been shipped to Minnesota, plus doses allocated to the CDC's Pharmacy Partnership Program. Data on the dashboard will be updated daily at 11 a.m. unless otherwise specified. For example, on the summary tab, the information in the bottom blue bar is updated weekly, so we note that. There is currently a limited amount of vaccine available to states from the federal government. Once doses are promised to states, it takes several more days before those doses are actually shipped. So it can be a week or more before they actually arrive at their final destination and can be given to people. That's why when you look at numbers like doses promised or doses shipped, they look much bigger than doses administered. Vaccine is moving throughout the state, but the process takes time. Additionally, we note on the dashboard doses that are directed to CDC's Pharmacy Partnership Program. This is a partnership between the federal government, state government, and private sector pharmacies to provide vaccinations in long-term care facilities. Vaccine doses for this program are provided from the state vaccine allocation, but we actually don't have a role in administering those doses as they go to the pharmacy chains participating in that program. In Minnesota, those chains are CVS, Walgreens, and Thrifty White. Vaccine is moving throughout the state, but the process takes time. We hope Minnesotans will find the dashboard helpful to see where we are at by showing progress at different stages. We are currently still in phase 1A of vaccination. There are 3 sub-priority groups in phase 1A, and we have moved to vaccinating people in the second sub-priority group, including assisted living facilities. We still hope to be done with the first doses for phase 1A by about the end of January. We will continue to share more information about what phase we are in, who can get vaccinated, and where they can get vaccinated as we move through this process. And then I want to comment on the announcement made this morning by the Trump administration. Many of you have seen the same media reports that we saw this morning about some changes in the direction of guidance coming from the federal government regarding vaccine distribution. More vaccine becoming available to more people more quickly would be a welcome development, but we'll follow the adage, trust but verify. A promise to deliver isn't delivering, and we've learned to be patient when it comes to federal government promises. At this point, no additional vaccine doses have been made available for Minnesota to order. No additional doses have been shipped to Minnesota, and no additional doses have arrived. We are hopeful about today's announcement by the federal government, but we need follow through. We have not received guidance in writing on all of these proposed changes yet. In the meantime, we continue with the extremely limited vaccine supply that we have, and we continue to focus on immunizing for impact, targeting those most at risk of contracting COVID-19 and those most at risk of serious complications if they get it. If our vaccine supply increases in the near term, we are ready for it. Planning for vaccines to be more broadly available has been happening in Minnesota for months now. We're making steady progress through the first group, that phase 1A, and have been working on plans for the next group of people who will soon be eligible. We expect that the next group will include people whose age puts them at higher risk for serious complications if they contract COVID-19. And today's announced, as well as individuals, who have underlying health conditions. And today's announcement by the federal government is consistent with that thinking and planning. So we are ready to receive more vaccines if the feds actually follow through on their promise. This announcement should bring more hope to all Minnesotans, especially those who are 65 years and older and those with underlying health conditions. We're closer to the end of this pandemic today than we were yesterday, but as we've learned in the past, we need the federal government to come through on what they are promising. We'll work over the coming days and weeks to make sure everyone who is eligible for a vaccine knows how, where, and when they can get their shot. Minnesotans can check mn.gov/vaccine for the latest information. And with that, I'll turn it back to you, Mike.
Thanks, Kris. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone. To withdraw your question, press the pound key. Again, if you would like to ask a question, press star, then the number 1 on your telephone keypad. Your first question comes from the line of Greta Cole from Maine Post. Your line is open.
Hi there. I'm wondering, we're hearing about in states like New York, there's been some problems getting all the vaccine that they've been allocated and that has gotten to the state out to people, it sounds like, because of some of the tighter restrictions the state had on who could get the vaccine. It sounds like this might be behind some of the changing it to making it people 65 and up getting the vaccine. But I just wanted to know, in Minnesota, which has tighter restrictions than some states on who can get the vaccine at first, has that been an issue at all? Like we've seen in other states where you just can't get enough arms of people who qualify, like we're hearing about in New York?
Well, this is Jan. I'll start and then ask Kris to chime in. We are getting data routinely from each of our 8 regional healthcare coalitions that we've talked about on prior calls, and they are the group that's been working with the hospitals and long-term care and local public health in their regions to estimate the size of the populations in these various priority tiers, and that they then help us to know where to allocate the next week's amount of vaccine once we learn that from the federal government. And through that process, we've not learned about a shortage of people in the priority groups waiting to take the vaccine. That has not been an issue. We do know from some of our healthcare provider partners that when they're offering vaccines to these priority groups, sometimes there are some portion of the population that doesn't want to receive the vaccine, at least not right now. So that leads to some supply being available for other groups. But generally, we are not having a problem not finding enough of the priority population to vaccinate. Kris, would you add anything?
No, I would just reiterate that we have plenty of folks who have not had the opportunity to be vaccinated yet. Those in our disability community living in group homes and our providers in clinics and other settings. So no, we have plenty of people to vaccinate at this point, still within phase 1A.
Thank you. I know that's something people are probably wondering about if they've read those other stories.
Your next question comes from the line of Tom Hofter from KSTP TV. Your line is open.
Hi, Kris. I don't know if you listened to Secretary Azar and Dr. Redfield today, but they were urging states to not wait for Category 1A to be vaccinated before moving on to people over age 65 or people under 65 who have comorbidities. Is the state prepared to do that and move to, pharmacy vaccinations and mass vaccination sites as they suggested today?
Well, yes. I mean, I was listening to that call. I think there's a couple of important points to acknowledge. First of all, that we have not gotten any information in writing from the federal government about this. What we learned was just like you, what was shared on that call. And as I mentioned in my comments, we're in the point of trust but verify. We have not gotten any increased allocation at this point. And if you've been sort of following the process of how vaccine moves into the state, we get the promise, the allocation, then we have 2 days to put it into the system, place an order, then it gets shipped starting on Sunday night, and it comes in the next week. So the allocations that we receive today may not get into Minnesota until late next week, some of them. So it's important to realize that we have not gotten any new doses. So for the public to recognize that there are no additional doses for us right now. There's been a message to open things up, and we've heard that, and we recognize it, and we've been planning to do that. But just want to be clear that there are no doses to put into arms to go along with that. So yes, we have been planning on how we would vaccinate with when we finally do get more doses, and how we will be able to stand up additional clinic sites and things like that. But I want to be very clear that the announcement was made, but there has been nothing provided to the states in terms of information about additional vaccine to utilize.
And two quick related follow-ups. Are vaccinations happening 7 days a week around the state of Minnesota? And I think you've answered the second part of my question. Is there no vaccine that's being held back for any reason when you get it? Are you getting it into people's arms as quickly as you can?
So yes, I mean, when we get an allocation to the state, that vaccine is distributed and shipped. So we are not holding back any vaccine. It's something that we're going to have to be thinking about depending on how the federal government manages second doses. So that's something that also has not been addressed. But at this point, no, if we get 100 doses in, we are distributing 100 doses. And in terms of vaccine being administered 7 days a week, that is something that we have talked with our partners about in healthcare, just to encourage them to make sure that they are vaccinating 7 days a week. When we look at the data, it shows spikes during the Monday through Friday and fewer doses on the weekend. And so we certainly let our partners know the importance of vaccinating, taking every opportunity to vaccinate.
Okay, so you are stressing to them this needs to be a 7 day a week operation?
Yes, we reinforce that with them.
Okay, thank you.
Your next question comes from the line of Jeremy Olson from the Star Tribune. Your line is open.
Hi, I know this is a bit speculative with the federal government changes just being announced, but one of the things they're talking about is proportioning the doses they send to states based on the number of people they've vaccinated so far. And we're about average, as we've talked about before. They're also talking about apportioning it by our senior population, and we're a little below average as a slightly younger state. I'm just wondering if you're concerned if they're going to change the way they distribute doses in a way that could hurt Minnesota if for some reason the data on our number of vaccinations is kind of holding us back or looks lower than it really is.
Thanks, Jeremy. Yes, I mean, we certainly caught that message. One of the things that was described was that they were planning to provide states with a couple of weeks before they made any changes. And if you're tracking the dates, there will be a new administration in place by that point. And so this announcement being made right on the cusp of one administration ending and another beginning but yes, I mean, they mentioned things like your 65 plus population, you know, just states with higher burden of comorbidities were a very healthy state. So there are a lot of things there. And I think, you know, we have appreciated the pro rata approach to vaccination, and we will wait to see, you know, what they have to say. As I mentioned to the other folks, the only information we have is what we saw in that announcement today, and we have not gotten anything in writing and have not heard anything from CDC or any of our other partners.
Follow-up question. I talked with a couple providers yesterday. They're gradually making their way through their available healthcare workers who have signed up and are eager to get vaccinated. So sometimes they're left with doses in their backup supply of workers, the people they just go down the hall to vaccinate. They're running out of those. Are you talking with them about ways to make sure no doses get wasted as we start to get through more of the 1A population and maybe allowing them to just vaccinate anyone when they have those extra doses? I know you said it's okay, but I'm just wondering if it's becoming more of a focus point.
I know the commissioner had some conversations with our healthcare partners today, and so, Commissioner, I don't know if you want to comment, but we have talked to them about the importance of also reaching out. You know, they've been very focused on vaccinating their own populations, their own staff, their own, you know, very much within their own system, and we've encouraged them to please reach out to affiliated clinic staff and other healthcare workers in phase 1A who are waiting to be vaccinated. But I don't know if the commissioner wants to comment on that.
Yes, this is Jan. I would just agree, Jeremy, that there is interest in being able to be flexible with the vaccine supply that we have, and that from the health system's perspective, they're eager to begin vaccinating their patient population. But just to underscore Kris's point, we're also just trying to make sure that all the different streams of planning for the next phases are coordinated and lined up with each other. So we're clear on who is tracking the providers that are not part of large systems and who's responsible for vaccinating them and so forth. But I think what you can expect to see is that, and I think we've said this from the beginning, that these phases wouldn't be strictly sequential, that as the supply allows, we would begin to move into the next phases, even as we're finishing up the prior phase. What this morning's announcement did, though, was sort of pretty much change the fundamental planning assumptions by saying that isn't necessarily a matter of when supply allows. They're kind of encouraging the system to open up to more eligibility, as Kris has said, without yet clarity on how the vaccine supply is going to increase to make that realistically possible for more people. So many variables that need to be pinned down here in the next couple of days. But there's a lot of planning underway about how we can begin to kind of vaccinate in multiple streams at the same time.
Oh, and very quickly, when are you putting out your 1B planning guidance from this Monday's meeting?
Well, that's the plan was sort of. I was just going to say, Kris, and I'll defer to you. That sort of has been impacted by this morning's announcement as well. So I'll turn it back to Kris for more specifics.
Yeah, I was just going to say a similar thing, Commissioner. We were planning to announce it next week to have everything put together to announce, but certainly this news impacts that. So yes, we will. We're going to need to reevaluate, you know, how we announce things in light of what we heard today. And I do think it's important, you know, I just want to comment that we do want to open things up and we want as many people to be vaccinated as possible, but without additional vaccine, adding more groups to the list that can be vaccinated, you know, it does open it up, but it can also lead to frustration. So we really are hoping that the federal government will come through with doses of vaccine to accompany that, so we don't find ourselves in a position where there are people who have an expectation that can't be met.
Thank you.
The next question comes from the line of Catherine Richards from Minnesota Public Radio. Your line is open.
Sure. Yeah, I just wanted to clarify what you guys just said. I think my question was along the lines of, if you are suddenly in a position where the federal government is saying you have to vaccinate everyone over 65, what does that mean for teachers, police, firemen, essential workers? I mean, does that mean they don't get the vaccine? And similarly, if they're releasing everything at once, does that mean that there's any question that people will have access to their second shot, which appears to be, correct me if I'm wrong, that you really have to get it in that very specific window?
Well, I think those are all the, Catherine, this is Jan, that those are all the very questions that we have, and that we're awaiting more information from the CDC and HHS at the federal level to know how we should be thinking about that. And it totally does just depend upon what we can learn about supply increasing, or if we do, as Kris said, have to now figure out that we're responsible for reserving the second doses, because that's what's being released by the feds. Then that's a whole other planning task and wrinkle in our system, which, as you've heard it said before, the whole premise was that the federal government would be reserving those second doses. And that's a very high priority, to make sure that people get the full series, because that's where we have the effectiveness data.
So yes, I think it's incredibly complex, and so and we need to review what we're hearing from the federal government in light of what our guidance had intended to be related to 1B, and then how do we incorporate all of that with the doses that we have or the doses that we may get. Because I think, to keep in mind, if we are looking at 65 to 65-year-olds, that's 530,000 in Minnesota. So 65 to 74, 75 is 388,000 people in Minnesota. And if you add in individuals from 16 to 64 with underlying health conditions, that's probably 30 to 40% of the population there. So that is a huge swatch of the population without a potentially huge influx of new doses, and that does potentially create some challenges.
Okay, and just to follow up on something you spoke a little bit about earlier, with regard to hospital systems vaccinating people who you would consider not to be in that 1A group, what are you saying to them? How widespread is it? Are all the hospital systems doing this? And are those rules that you set out about who should be vaccinated first enforceable? I mean, is there anything you can do to say, no, you can't do that, or is it really, at the end of the day, at their discretion?
This is Jan. I'll start. Yes, it is guidance. It's sort of the rubric that we developed to kind of follow those principles that we've talked a lot about how do you maximize for immunizing for impact. And so we are kind of trying to clarify that guidance, just to remind people who was in the various tiers. We've certainly reported that some of what we hear is anecdotal, and it's understandable, as I think Jeremy was relating the experience of when you have extra doses and you want to administer them immediately, you reach out to other populations of staff. But in terms of how widespread is that, I don't think we have any hard data. There are certainly examples of it that we're aware of. But Kris, would you add anything different?
Well, I was just going to say we are aware of several systems that have made some decisions kind of on their own. So we know that there are several systems that may be doing some independent decisions. But then, as we commented on, there are some situations in which you are vaccinating quickly to avoid wasting doses, and that's important. It's just challenging when decisions are made that are planful about not following the guidance. Our goal is really to make sure that everyone who is at risk or is in a role that needs to be vaccinated can do so in the most expedient manner.
Okay, thank you.
Your next question comes from the line of Brianna Clear from Political. Your line is open.
Hi, thanks for doing the call. Just a question on the long-term care program. So is the state planning to or already taking any actions to speed up the pharmacy partnership program to vaccinate long-term care facilities? And second question, if the pace doesn't pick up, will the state withdraw from the program and kind of lean on local and independent pharmacies?
Well, a couple of things. We are monitoring what's happening in that program. However, it is a federal program, and so the contracts are between the federal government and the pharmacies. And so, you know, we can't pull out of the program at this point. The doses have been allocated for that program and have been set aside, and will go to those pharmacy partners through the vaccination. So, it's not a situation where we could just step in and say we're not going to do it anymore. But as I said, we are monitoring, and certainly there have been things that have been done to help ensure that these pharmacy partners are as able to be successful as they can be, including bringing in staff from out of state to help if that will make a difference.
Your next question comes from the line of Garrett Short from ABC6 News. Your line is open.
Hi, looking at senior citizens that are getting vaccinated, it says that here in Minnesota on the website, 13% of vaccinations have been senior citizens. Just comparing that to other states, clearly, obviously, every state is different, but looking at Florida, 51% of their vaccinations have been seniors, which is drastically higher. And then looking at Indiana, theirs is 4.7% have been given to seniors, which is lower. And what do you attribute these differences to when you're comparing state to state?
Well, this is Kris. I can take that. Well, a couple things. In Minnesota, with our vaccine, in this first stage of vaccination, we prioritized healthcare workers and then individuals who are in our skilled nursing facilities and in assisted living. And so those are the groups that we prioritize. Now, just to be clear, we've just been talking about this federal pharmacy partnership for long-term care program. The vaccinators in that program have 72 hours to get their information to us, which is longer. It's part of their contract with the federal government, but that's longer than other vaccinators have. So we know that the data that we're getting on vaccinating those elders is delayed. So we know that, and so that's part of the problem or part of the issue. But Florida they had a plan, and then they sort of ditched their plan and just said we're just doing 65 and older. So their healthcare workers have been kind of left to fend for themselves to get additional vaccine. So that would account for why their proportion vaccinated is so much higher. I don't have any insight into what's happening in Indiana, so can't comment on their lower numbers, although if they have a high proportion of elders who are being vaccinated by the pharmacy partnership program, we know that that is going a bit slower, and that could have impacted their numbers. For example, West Virginia had to do the vaccination kind of on their own because they didn't have any of those partners in their state, and they were able then to do that more quickly because they did it independently. So it's really quite variable by state because of who and how the vaccines are being provided to the elder population.
Thank you.
Operator, we have time for one more question.
Your last question comes from the line of Tom Lydon from Fact 9. Your line is open.
Thanks for taking the question. Do you worry about the confusing messages that are being sent, especially today? You have the feds reversing themselves today and saying, well, we're going to do only 65, we're going to do all 65 and up and release the doses. Someone listening to this call could say, well, now the state's saying, well, we don't believe it until we see it. We don't believe it until we have those doses on site. I imagine for a lot of people, this is really unsettling and very concerning. And I imagine that the overall impression might be the people that we don't know what's going on. What would you tell the public today just about this confusing messaging?
Well, this is Jan. I'll start, and I think it's a very fair point. Certainly, when plans change and the message changes, it does create the opportunity for confusion. Just to be clear, not all of us would like to see the process speed up and for eligibility to expand as long as the vaccine supply expands commensurate with that. So I think all we're really saying today is we would welcome the opportunity to get going faster on those with underlying conditions and over age 65. That would be a good development. We're just sort of registering that there are a lot of unknowns yet in terms of just helping manage expectations about how quickly that's going to happen or exactly what that's going to look like, is that we just need more information. And, we've talked a lot about the importance of just clarifying that whether what's going to be released is increased supply or whether it's just releasing the second doses that have been reserved for second doses and releasing that for us to instead use that for more first doses and deal with the second dose problem later, which just would be another logistical thing to figure out. But it's not so much that we don't know what's going on, it's that we need a lot more information before we can operationalize this, but we have every intention of doing that. Kris?
Right, I think it's important to note that, the information that we've gotten is the information that was provided to the media. And while that's helpful, that is not sufficient level of granularity to plan a widespread mass vaccination program. So we definitely need more information. And as the commissioner said, it's not an unwillingness to expand vaccination, but as you may have heard in my earlier comments, we are looking at right now, if we add 75 and older only, that's 388,000 Minnesotans. If we add 65 and older, we add an additional 530,000. So we're looking at, almost 1 million people in that group. And then when you add individuals 18 or 16 to 64 with underlying health conditions, that's a huge chunk of our population. So we're all of a sudden, with this announcement, potentially adding a couple million people who will expect to be vaccinated. And if we are only getting 60,000 doses a week, that is going to be a real problem. So we're just trying to make sure people are aware of the numbers and what we're dealing with here, so that they can have reasonable expectations of what's possible.
And some quick follow-up on that, and then an unrelated question. I did hear that number, and 530 for 65 and up is equivalent to the total doses that Minnesota has already been promised from the CDC at that point. So you just look at those numbers, and that almost seems untenable. Is the next time that you're going to get a snapshot that will make you feel better about the supply coming from the feds, is that going to be next Tuesday when you get that information, or will you have any sense before next Tuesday? And it's an unrelated follow-up, but I think it's an important question. My understanding is that there are some healthcare workers who are delaying the vaccine. That number may be very significant, as many as 30%. They're not people who don't trust the vaccine. They're just kind of, I want to wait and see. What do you know about those numbers?
So a couple of things. Yes, our expectation would be that if things proceed according to the usual schedule, that we would hear next Tuesday. However, we had no preparation for this, so we may be hearing something at a time that's off schedule in terms of updated allocation information. But typically, you're right, we would hear on Tuesdays. And as for the number of healthcare workers who are deferring, we have heard anecdotally that yes, there have been some healthcare workers who said, yes, I'd like to wait. I don't want to do this right away. That's not something that our vaccinators need to report to us, so we don't have data that we can actually speak to. But yes, that will mean that there's a number of additional people who would have been normally vaccinated in phase 1A that will now have to wait to see if they can get vaccine as we're opening things up. So it's certainly, there are just many considerations, as the commissioner said, and as you heard from some of the earlier questions asked, and we are just working to make sure that we have the best information available from our federal partners that we can do the best planning, but we want Minnesotans to have a clear understanding of where we're at with the doses that we have access to so that they can have realistic expectations.
Thank you. All right, that is all the time we have for this afternoon. We invite anyone with additional questions to reach out to our office this afternoon. Have a good day, and we will be back with you again soon.